Us now, a congressman who will be getting on a bus to the White House very soon, New York Democratic Congressman Paul Tonko. He is also a member of the House Budget Committee. Sir, welcome. Good to have you here today.
Thank you very much, Martha. It's great to join you.
Well, it's great to have you with us. You know, we're in obviously very serious times, as we just outlined, and you just heard Stuart Varney outline. And I think the fear that a lot of Americans have is that Democrats are so dug in and Republicans are so dug in that they're going to allow election-type issues to prevent them from making the kind of cuts in spending that needs to be made.
Right. I think there needs to be this bipartisan spirit of cooperation if we're going to get things done. There's no denying, Martha, that this was a huge pit out of which to climb. We started with 8.2 million jobs lost. We've grown 2.2 million in the private sector. But as you just reported, there's been somewhat a slowing in the economic recovery. And I think a lot of that is driven by energy costs. And those have to be addressed by looking immediately at the speculating process, which I think is bidding the price on fuel costs for our businesses and for our trucking industry. And that undeniably has an impact on our economy.
You know, obviously, one of the big questions is Medicare. The president has not necessarily said that he thinks that Medicare cuts are off the table when it comes to striking some kind of deal to get this debt ceiling raised. Democrats have been largely very much against that idea in terms of the Paul Ryan plan, to be sure. What about you? You know, are you willing to see some of these Medicare cuts made in order to find some compromise on this?
Well, you know, what I think we have done in the Affordable Care Act is improve Medicare. The Republican plan is to end Medicare. I support keeping Medicare intact. We need to improve it. We need to do bulk purchasing of pharmaceuticals and to rein in fraud and continue the efforts that we made in ACA to strengthen Medicare, but not to end it. The public doesn't want that. Pardon
me for interrupting, but there's a really interesting editorial in today's Wall Street Journal, and it was written by one of the trustees of Social Security, I should say, excuse me, and Medicare, and he claims that under the Obama medical program, under the Health Care Reform Act, that in fact people 65 and over would see their benefits shrunk by $36,000 as soon as the plan kicks in, and that is basically the equivalent of losing 3 years of benefits. So what they're saying is that the pain for seniors would actually start right away in 2014. The Ryan plan wouldn't affect anybody over the age of 55.
Well, no, see, the plan is ending Medicare. Once you take the risk and shift it to the senior citizen from government, you have ended Medicare. Once you have people with a voucher, a coupon that does not cover more than 32 cents of the premium cost, you've ended Medicare. What we have done is deny overpayments to companies that were given incentives to start up what were cheaper plans. When those plans proved to be reimbursed at too high an expense, we reduced that. But we have made major efforts towards reining in fraud with Medicare, reducing that, bending that cost curve, and we'll continue to do that. And I think that's the compromise that we have to see at the table. Not to end Medicare, strengthen Medicare.
Well, you know,
and its trust
I mean, no
fund.
doubt, you know that Paul Ryan has said that that's been mischaracterized and that he's not at all talking about ending Medicare, that what he's talking about is putting the payments directly from the government to the insurance company and allowing for open competition for people to bid on their own private plans. It'll take us all day to go back and forth, but we just have to say that.
Martha, when you pay 32 cents to the senior to go and shop for every $1 that senior will need for the premium cost, you have reduced, you've ended the program, you've changed it, and you've shifted the risk to the senior individual.
A lot of debate about that,
right.
And we wish you well as you head in there. And it will continue, and we thank you very much for being with us, Representative Tonko. Good luck
Thank you very much
to that meeting.
Look
forward to hearing what's coming out of that.